And as the Bahamas closes in on 23,000 COVID-19 infections on record, health officials petitioning not to let our guards down. Dr. Nakia Forbes urges protocols saves lives as she shares her views on how the holiday season may impact COVID-19 stats. Altavi's Munnings reports.
COVID is not going away. It's going to be here for a while, and we have to learn how to live with it and protect ourselves.
2 years in, and the Ministry of Health and Wellness has generated enough statistics to see just how the COVID-19 virus transmits across the country. Here's the trend. According to health data, the first COVID-19 wave in March 2020 was the smallest. The second wave generated in the summer around July 2020, and it didn't flatten until the fall. Fast forward a year later to March 2021 with a third COVID-19 wave that peaked again in the summer months. Current numbers show the third wave's increase has passed and there is a flattening of the curve. However, a fourth COVID-19 wave could be imminent, and health officials underscore the need for everyone to remain on guard.
We did not have a lot of Thanksgiving travel last year because there were travel recommendations to cut back on travel in the US and here at home, and that's different this year. And so theoretically, there is a risk of an uptick in cases associated with travel and holiday gatherings.
And as we start the holiday season with current COVID-19 stats remaining low, infectious disease specialist Dr. Nakia Forbes wants to preach to the choir that COVID-19 protocols must continue to be enforced at all times.
For COVID to spread, it simply needs new cases being introduced, people that are gathering in close proximity, unvaccinated people not wearing masks. That is all that is needed for COVID to be out of control again. So we have to be careful and safe going into this holiday season.
She also acknowledged that COVID-19 vaccine hesitancy is real, with only between 35 and 40% of Bahamians fully vaccinated.
We have not vaccinated sufficient of the population to put us in a place where we're out of the woods now as it relates to hospitalizations and deaths. And vaccine hesitancy is playing a role, and we do need to understand and meet people where they are in terms of the reasons that are causing hesitancy. And this is going to be challenging, especially as we try to grapple with effective, for example, vaccines and immunity as we try to live with COVID and try to prevent the interruption COVID can cause to our society when it's out of control.
Altavi's Munnings, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.